Hi, this is Amber Tackett, and this is my quick presentation of the overview of a traumatic brain injury. So when you first think of brain injury, traumatic brain injuries, you think, just damage to the brain and possibly like skull fractures. But there are head injuries that involve the scalp and also the blood vessels in and around the brain that we also need to be aware of. So in order to assess these patients, the first thing you want to do is go over the Glasgow Coma Scale. So just a quick recap, the three areas to test for in a Glasgow Coma Scale is for eye-opening, verbal responses, and motor responses. It will never be greater than 15, and it'll never be lower than 3. The worst score you can get is a 3. So you need to see if their eyes are opening spontaneously, to sound, or to sternal rubs, or not at all. If they're oriented, if they're confused, their words and sounds are a little off. And then for motor response, seeing if they can obey commands, if they localize any pain, if they have normal flexion, extension, all that. So that would be, like I said, the lowest would be a 3. Traumatic brain injury patients usually have, if they're bad enough, would be between a 3 and an 8. But I guess it really just depends on the severity of the damage that is done and if it is a primary or a secondary brain injury. A primary brain injury is a direct injury to the brain from some sort of impact. But a secondary brain injury is an injury that occurs as a consequence of that initial injury. So for example, you hit your head on the dashboard, that would be the primary, but the secondary would be the possible increased intracranial pressure and any like hemorrhage or fractures or anything like that would be the secondary. Other symptoms that you would notice is possibly dysphagia. They might have fevers, headaches, a pretty obvious one. You also want to monitor for any fluid electrolyte imbalances. So those are kind of the big things, and traumatic brain injuries are typically pretty easy to assess. You can see that there's some kind of issue with the head or face, but sometimes if they're not completely obvious, like a open laceration or anything, you can notice things that are called battle signs or raccoon sign, I believe, where the eyes, both eyes will be black. If there's a lot of blood behind there, and there's also battle signs behind the ears, the bruising behind the ears can also demonstrate signs of a brain injury. And also you can look inside the ears and you can see if there's any drainage of clear, which is cerebral spinal fluid, or any blood coming out of the ears can be indicative of a brain injury as well. So moderate and severe TBIs, like I said, they'll have a lot of different issues going on. If they lose consciousness at all, we definitely want to let the provider know exactly, or at least roughly, how long they were out. You also know here if it's greater than 30 minutes, that makes it a moderate or severe TBI because the brain was not able to recoup very fast. Again, headaches, migraines, dizziness, all that stuff is probably expected. Seizures are a big one they need to look out for, so seizure precautions are usually put on TBI patients. Cognitive is another big one, and you can definitely tell which side of the brain was probably injured depending on their cognitive or even emotional issues. So left-sided versus right-sided, you can probably at least get a good guess as to which side was affected. Sometimes it's both, so sometimes you'll have both of those issues. So like I said earlier, this is a traumatic brain injury patient with this is the blood, and the clearer-ish outline here, it would be cerebral spinal fluid. So that is definitely a nursing concern. So treatments for a traumatic brain injury can vary. Induced hypothermia is one of the good ones. It decreases the brain's need for oxygen. It also helps decrease intracranial and cerebral pressure. This is because, when you have swelling of something, you typically need to put ice on it to reduce that swelling. So it's no different with the brain. Lowering that temperature will help with that. Also ensuring there's good nutrition for these patients, like high in protein to help with that wound healing. And there's also surgery options. Surgery such as skull fracture, they might need to remove various fragments, or they could do what's called preventing herniation. So that's for like subdural hematomas. They will get the blood out of there and reduce that pressure, probably leave a piece of the scalp off just to help with that pressure and again preventing any herniation. If there are any penetrating kind of wounds, such as, a bullet or anything like that, that may need to be removed. And also, again, with those bone fragments may need to be removed. But it kind of just depends on if it's, holding pressure on some arteries. Some doctors may leave them in. But they might need to do an exploratory surgery just to make sure everything's okay there, and a lot of imaging to keep up on it. There is also drainage that could come from it. So they might put in a lumbar drain or ventriculostomy, I believe is how you say that, into the brain. So basically just a tube letting all that leakage come out. And so it'll be easily monitored for as well. So you can monitor how much is coming out versus what it looks like and all that fun stuff. So the cues, they may not always be obvious. Like I said, it may not always be an open skull fracture where oh, this person's brain is probably not looking good. So you need to look for a lot of different things. You may need to rule out a stroke versus a hemorrhage, a different kind of hemorrhage. So you definitely need to look at all the possibilities that are affecting this patient. Priority is always going to be airway with these people. Airway is going to be the first thing. They may not be able to be cognitively aware to keep up with their airway and breathing. So that's definitely one of the first things you want to take priority in. And then obviously circulation, because they're bleeding out. You want to make sure you're on top of that as well. Solutions are usually surgery or some kind of immediate intervention that is needed. You want to take that action as soon as you can, making sure, again, you obtain as much history and information as you can so you can get the right treatment plan started, and then evaluating the effectiveness of those interventions, such as is the intracranial pressure lowering, is the hemorrhaging stopping, are they still bleeding, are their black eyes getting worse, is the battle signs staying the same, or is their cognitive impairment getting better? Is it getting worse? Many things you need to evaluate and continually watch these patients. They can decline very fast and might not always have the most obvious signs. So thanks for listening, and I hope you learned something.